how do those gaps in staffing then in turn impact revenue, patient outcomes, most importantly, and then also market share as we look at markets? Lance, I want to start with you here.
Yeah, thank you, Lucas. So, in considering this, I know Phil probably looks at it from much more of a bottom line standpoint, and he's likely the best individual to answer that. But what I'd like to touch on is the damage unseen. When we have situations where perhaps it doesn't affect the bottom line right away, but you might have a specialty practice who has a physician depart for whatever reason, and then you
Mm-hmm.
have specialists or surgeons who are taking 1 and 2 or 1 and 3 call rotations over a year or two period while they search for a permanent hire to that group. It really destroys quality of life and probably does immediately impact patient outcomes as far as bandwidth, as far as fatigue, just in regards to that.
Yeah. Phil, I'd love to hear your perspective on this. Lance sort of teed this up. This is something
Yeah.
that you're probably seeing firsthand.
Right. So Lance is right. You definitely would be concerned that delays in access to care or cancellation of case volume could compromise a patient outcome. From the anesthesia perspective, what we note is that staffing gaps that reduce OR volume, ultimately reduce revenue for the hospital, our system partner. And so that is an important consideration. We want to make sure that the patients in the community have access to the resource. We want to make sure that those cases are getting put through in a timely manner. And so, inconsistent coverage can cause patients to, seek care elsewhere. And whether that's with a local or a regional competitor, if somebody is in pain or they need a procedure done, that case is going to get done. But it gets done in your system or somewhere else, it's going to get done. So, we view it as, the anesthesia component is critically important because, the hospital OR can't run without it. But a gap in coverage is negative for overall throughput, and it's negative for the bottom line.